Okay, so you go to My Student Center and that works. Okay, good. All right, thank you so much. If you guys remember, try to clock out at 11 o'clock. We'll see what happens. We're learning. Cool. Awesome. Okay, and by the way, I want to reassure everybody in Australia, like, this system is live and it really is calculating hours, but we're doing paper backup, so we'll fix mistakes. Like, we will not mark you absent, Miss Tops, for clocking in late. We have the backup of you actually being here. We're just trying to get in the habit and make sure it really works. All right. So let's talk about the muscles of the back. So this is your spine, right? And it's actually an amazing thing. What's really difficult about a spine is if you look at the way it's built, by the way, note some really interesting features here. The back end here where your pelvis is, this is the back side here, actually curves out. Your lumbar region curves in, your thoracic region curves out, and your cervical region curves in, and your head curves out. So there truly is an S shape to your whole body from the top of your head all the way down to your butt. And believe it or not, by the way, your pelvic area and everything curves out. Hold on, I've got somebody who's got their mic on. I don't know who.
Miss Langford, you're not muted.
Oh, I'm sorry.
Don't be. I can turn you off. I just couldn't find who it was. You don't have to feel bad. You didn't say anything, at least. I'm always worried somebody's going to say something like, who is this idiot? And we're all going to hear it, right? I mean, I know you're thinking it, but I don't want to hear it. Okay, so anyway, not only do you curve out at your head, in at your neck, out at your thoracic region, in at your lumbar region, out at your pelvis, but believe it or not, your femurs curve out. Your femurs have a little curve to them, they curve out just slightly. So you really have this curving system here, and that's because curves work better than straight lines in absorbing stress. So you need to bounce up and down and have this stuff kind of give with that. And so the curves are extremely important. When you look at a spine straight on, you hope you don't see curves. Actually, this one you do. But you hope you don't see curves to the left and right. That's called scoliosis. But from the back or the front, you should see these curves in and out. Now, one of the problems with a spine, one of the beautiful things about a spine, is each one of these little joints has cartilage between it, which makes these cartilaginous joints. They are different from synovial joints. This is just 3 synovial joints working, right? Really, it's just 2 synovial joints working. You can see how much movement they can get. Cartilaginous joints don't get that much movement. They're super duper strong, but they're not like full of sacks of fluid around them with full movement, and they really just move a little bit. The reason you can bend over and touch your toes, I mean, one reason you can bend over and touch your toes is you bend at your hip, but the reason you can curve your back a lot is all 24 of these joints are bending a little bit. And if 24 joints bend a little bit, that ends up being a lot. Does that make sense? But each back joint moves very little. Very little. And these cartilaginous joints between here are your vertebral discs. When people talk about slipping a disc or something, you don't really slip a disc, by the way, but they can bulge out the side. This is what they're talking about. And by the way, I want you to look at something here as we get close here. You can't touch the discs from the back side here. There's no way. People always worry, they're like, oh, I've got a disc problem, I don't want you to mess it up. I don't know what you're going to hit that's going to mess it up. Like, there's bone protecting this. If you're getting down to their disc, there's a problem. You're using a drill. So, there really isn't a lot of danger. Now, these things coming out the side are nerve plexes. And you can put pressure on them and they feed the rest of the body, and that can be a problem. We're actually going to talk about these tomorrow with the nervous system. And so you can hit those and kind of zing them. But you can't really affect the discs from here. So anyway, the back is very protected. And the spinal cord itself, where these guys are coming out, these are all coming out from a spinal cord. The spinal cord is literally in a hole that runs down your back that is covered by bone. You cannot hit the spinal cord. You can wrench them around and do stuff to them with some crazy stretches that might kind of hurt them. Still wouldn't damage the spinal cord, but I could see you putting somebody in a lot of pain. But that spinal cord is very protected. You can't hurt it with a massage elbow or something. You can hurt them, but you can't damage the spinal cord. I'm just telling you this because you're going to have people be like, whoa, that's on my spinal cord. There's no way. It doesn't happen that way. You need to respect the fact that they're freaked out and stay away from it. But I'm just letting you guys know, you're not going to paralyze somebody with massage. Definitely not by rubbing them. If you did want to paralyze them, what you need to do is move their neck really fast and really hard, which you would never, ever, ever do. Because we don't do fast moves in massage. That's karate. That is the only difference between massage and karate, is speed. I'm serious. Karate, I use my elbow. Massage, I use my elbow. Massage, I use my elbow slowly, and it's loving. Karate, I use it fast, and it's mean. That's it. Honestly, speed does everything, right? A bullet is just a BB going really fast, but it doesn't hurt you. You throw it at somebody, no big deal. Make it go 100 miles an hour, it's a big deal. So, if you work slowly around the back, you can do basically anything they can tolerate, and they can usually tolerate quite a bit if you're going slow. You can kind of annoy them if you start to run over bumps and bones and stuff. It's not great, but you're not going to kill anybody. All right. So, one of the problems with holding this spine up, right, this thing has a rod going through it to hold it up. But even look at this. It kind of wiggles around here. It's got problems. And it's got to support my upper body all around this spine and my head and all that kind of stuff. And your head weighs a lot. It's 10 pounds up here. When I stick out my body like this, that's 10 pounds sticking way out there, which feels like a lot to my neck. So, we've got huge spinal erectors that run up here, run up and down here, right? Yeah? Mr. Bigelow, what are the 3 spinal erectors that run up and down my back? My 3 erector spinae muscles.
Spinalis, longissimus, and iliocostalis.
Yes. So the spinalis grabs on basically to the spinous processes of the back and run down here. The longissimus grabs onto the head and really basically the transverse processes as it moves out, goes all the way down here. And the iliocostalis grabs on kind of the side of the neck, swoops way out and grabs all the ribs and comes back into the hips here. And those are your powerhouse. When you're doing deadlifts, or you're picking up your child when you bend over like this, which feels like a deadlift because they just lay there like that. I don't know why they do that. But anyway, when you're doing that, it's the spinal erectors, the erector spinae group that's really helping you get them back up. But they're actually not enough. So you've got to sew all of these vertebrae together because they need integrity in between each other, not just some big powerful muscles pulling on up here. So underneath, and this is what we're going to learn about today, this is just my little overview, underneath these spinal erectors, underneath this erector spinae group, underneath the spinalis, longissimus, iliocostalis, are some other muscles called the transversari group. Don't even worry about that name. But the transversari group is a group of muscles that hooks to the transverse processes and other things. And you've heard about these. We've learned about the multifidi and the rotatories, and we're going to see pictures of those today. The multifidi and rotatories look like shoelaces here. We're also going to learn about a muscle called the semispinalis capitis, which hooks on the transverse processes and hooks to your head. Little note, by the way, when you hear the word capitis, like baseball capitis, it means it goes to your head. Anytime you hear capitis, it's got something to do with your head. Yeah? It's important to know, right? There's a couple of things we're starting to learn in anatomy, right? Capitis always goes to your head. That muscle has something to do with your head, or it's on your head, or in your head, whatever. Capitis. We've also learned that anything that says pollicis goes to your thumb. Anything that says holosis goes to your toe. Anything that says digiti minimi goes to your little finger or your little toe. Anything that says digitorum goes to your fingers or toes. And there's one more I want to tell you. And seps means heads. So you got biceps, which is 2 heads, and quadriceps, which is 4 heads. And those are just handy things to know. Yeah. All right. So we're going to learn about the transverse, and that's like the multifidi and rotatories and the semispinalis capitis, which is kind of important. Well, they're all really important, actually. And then we're going to learn about these muscles that are so tiny you will never touch them, but they do help keep your body together. And they're actually between the little processes, like right in here. And the reason you'll never touch them is you got loads of stuff over the top of them, but you actually have muscles in between the spinous processes in this little area in here to hold each little vertebrae to the next vertebrae, and you've got muscles in between these transverse processes to hold each transverse to the next one. You mainly have them up here and down in your lumbar region because those are areas that need extra support, but those are even deeper than the rotatories and multifidi. So we'll be learning about stuff like that. We're also going to learn about intercostals, which is the muscles between your ribs, because your ribs have a lot of integrity because they have muscles between them that keep them from stretching too much. And that's actual rib meat. When you guys eat ribs, you're eating intercostal meat of another animal, hopefully not a human. Yeah. Okay, so I'm going to show you a picture of this. We're going to talk about all this, but I always like to give you kind of a preview of where we're traveling today. Yeah? Good. Awesome. Okay. Let me share my slide presentation. And we'll do this for a little bit, and then we'll take a break. We have to ease you guys back into your classroom routine here. Dun, 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 dun. Here we go. Love it. Okay. So, beautiful picture of the back here. So, I want to let you know where we're traveling to. This left side has the trapezius here and latissimus dorsi here, right? To get to the muscles we're talking about today, we have to rip off the trapezius. So when you're massaging somebody, you're massaging through their trapezius and really in some ways through their latissimus dorsi and their thoracolumbar aponeurosis for sure. So we're going to rip that off. This picture on the right is a picture of that stuff ripped off, and you still have to go through the rhomboids and something called the serratus posterior inferior that we haven't even learned about. And if we do all that, we get down to the spinal erectors. So we've already ripped off kind of 2 layers of muscle just to get to the spinal erectors. So now we've got the spinal erectors here, right? And we're going to be going below them. So there are layers upon layers in the back. So I just said we kind of have to rip off the trapezius. I said the lats, but the deltoids too. Underneath them is the rhomboids and the serratus muscle, right? Underneath them, I just told you, is the erector spinae muscles. We know this, which is the spinalis, longissimus, iliocostalis out here. Boom. And that's going to get us, after we tear these off, you can't even see the muscles that are in layer number 4 yet. But the muscles we're going to be talking about today are the multifidi, the rotatories, the semispinalis capitis. We're also going to be talking about internal and external intercostals, which are rib meat, which are way under here, not shown in this picture. And we're going to go even deeper than that to muscles that you'll probably never really directly rub, which is the interprocesses, muscles that fit between your spinous processes. And that helps to support those as well. So you are only looking at level 3 in this picture. We are going to be talking about level 4 and 5. By the way, these are levels I made up. I don't know that people call it level 5. I'm just trying to give you an idea of the layers of the back. Nowhere are we going to ask you, like, what's on level 4 of the back. I don't even know. I wouldn't know what that meant. I'd be like, there's a lot of stuff down there. Yeah. Cool. Don't you just love the human body? It's just amazing all this stuff's going on inside it. And we don't even know what we're doing right now. We're just scratching the surface. Yeah. Let alone the soul that just dwells inside it and just makes it come to life. Yeah. I love it. Awesome. Okay. And all the while down here is this thoracolumbar aponeurosis. This is why I tell you it's really hard to talk about where the spinalis, the longissimus, the iliocostalis, the lats, all this stuff inserts because it really just weaves into this big area of fascia down here, this gristly area of fascia that kind of attaches to everything down here. And goes over the sacred sacrum, which is what we're going to call it from now on because of what Miss Tops told us. It's the sacred sacrum, yeah. She'd laugh right now, but she's got food in her mouth. Don't choke. Don't choke on me. All right. So, we go down and we rip off all that stuff, and we get down to here. You can affect these muscles. You can affect these muscles. And down in this area is the transversospinalis group, which, by the way, I've never heard anybody outside of anatomy class. They'll refer to these muscles, but they don't ever talk about this group. But you will hear them talk about the multifid rotatories and semispinalis capitis. Sorry, semispinalis capitis. Semispinalis capitis is not shown in this picture up here. It runs up and down by your neck, and I'll show you a better picture of it in a second. But you can see these shoelace muscles here. They've got the rotatories on one side and the multifid on the other side. Now, on your body, you've got them on both sides. They're trying to display that for you. But anyway, these shoelace are little bugs that live in your shoe. Shoelace-like muscles, and all of the multifid and rotatories essentially tie a transverse process of one vertebrae to a spinous process of another. So if you can see me here, all of these things just hook like a transverse process here to a spinous process up here, or a spinous process way up here. But they shoelace stuff together. Not their own transverse process. No point in tying my ear to my nose. They tie this transverse process to a spinous process upstairs. So, and they help tie the vertebrae together because it's amazing to stack 24 things on top of each other and have it work. Now, also pictured in this picture are the intercostals. And inter in anatomy actually means between. So intercostals means the muscles or the meat between the ribs. Costals mean ribs, and inter means between. Interstate transport is transport between states. So the intercostals really are rib meat. It really is the ribs you eat, and I just keep bringing it up because it gives you a way to kind of like be like, oh, like it. That's exactly what it is. It is meat found between the ribs. It helps your ribs expand and contract. They have lots of benefits. That they also just act as other levers in your body. Like they can grab on and pull the ribs, which are attached to the back, and help the back lift stuff. So they're very important. And this cross section, let me see if I can show this cross section to you. This is looking down. By the way, your spinal cord goes right here. In this big foramen. Foramen means hole. That's why I meant you can never hit the spinal cord. It's protected by bone all the way around. But what they're trying to show you is the layers of muscle that you would see way down in here, and so you can get a feeling of where everything is, that you have to go through the spinalis to get to the multifid and rotatories. They're way down in this area here that we call the what, Miss Smith? I know you have a question, but I have a question for you. Miss Smith, what do we call this area between the transverse process and the spinous process?
Interstitial groove.
That was actually pretty good. How about lamina groove? Yeah. Anyway, lamina groove. All this stuff kind of lives in the lamina groove, which is why when we're elbowing the back, we try to get as close as we can to the spinous process without hitting it. Because there's a lot of good stuff to hit her. Miss Smith, what was your question, madam?
So I understand what you're saying by like we're never gonna come in contact like with the spinal cord, but we still can affect it like with our pressure.
Oh yeah,
And
I'm
so
sorry. Yes, you can. Yes, you can.
Okay.
Absolutely. You could, let's say somebody's got a herniated disc. And I don't know if this has a picture of a herniated disc. We used to have one of these with a herniated disc. Anyway, herniated discs often stick out here, and they'll press on this nerve coming out the side, and you can't. I'm not even really so much worried about you hitting it with your elbow this way. That's pretty hard to do, but you could bend them in ways that would really upset that nerve. definitely stretching is something you have to be careful of. And by the way, they could be so tight and locked up down here that you press on their back puts them into spasm.
Right.
Absolutely. So I just meant,
like I have back problems, like exactly what you're talking about. So I just wanted to like emphasize that no, you may not touch these things directly, but you can still seriously like.
I'm not laughing at your pain. I'm laughing because you're
I know,
you're also kind of preparing everybody for lap. Like, just because Tapscott said you can go to town does not mean you can jack up my back. That's why I'm laughing. She's absolutely right, everybody, by the way. I'm trying to reassure you that you won't cause permanent damage. Can you lose a client over it and send them into spasm? Yes. Yes. Because their back can be so tight that when you dive in there, that it just sets off all the nerves and everything back there. So yes. I just meant people kind of think that you're actually hitting the nerve or the spinal cord or something. You're not. But yes, you still have to treat it with the same. So let me divide up. By the way, thank you, Ms. Smith. Let me divide up every comment I make here. I am trying to get you guys to go deep and not be afraid to work on the human body. But everything I say gets trumped by how the client's feeling. I might think Miss Smith needs deep tissue. Miss Smith decides what she needs, right? No matter how good you are. Like, I've been doing this forever. I just tell people, like, hey, can we go in here a little bit deeper? I think we can. And if they're like, nope, or they're not reacting well, that's it. That's the end of the discussion. I don't have an argument about it or anything, because nobody knows their body better than they do. And Miss Smith's right. I probably wouldn't cause permanent damage, but could I send her back into spasms that would bother her for the next 3 days and make her not very fond of me? Yes. You're absolutely right. Thank you. Thank you. But I wouldn't paralyze her. That's my point. It's a couple days of spasms. Jeez, picky. Okay. And by the way, the real key for most people is to go in slow on the back. It's not about how deep you go. It's how slow you go in and coming out slow. If you leap back out of somebody with back stuff, their back kind of cinches back up again. So and when you're stretching them, like if you contraction them, you go really slow letting go. You don't want them to pop back together, right? Everything needs to be slow on and even more importantly, slow off, because that's when they tend to spasm. Okay. Here is a picture. Here is a picture of the semispinalis capitis. It runs right here. It actually attaches from your transverse processes here and goes up to the back of your head. It is underneath the trapezius. The trapezius has been cut away here. It is right here. Some people call the semispinalis capitis the speed bumps of your neck. Do you guys know how on the back of somebody's neck you see two bars going down? I don't know if you can see it on me, but you'll see it on back of people, these two kind of speed bumps running up and down. Do you guys know what I'm talking about? Just the back of somebody's neck? Okay. The trapezius is on top, but that's actually the semispinalis capitis underneath pushing up on the trapezius. So those two speed bumps are the semispinalis capitis underneath the trapezius. And so they sometimes call these the speed bumps of the neck. Yeah. And that is something kind of good to know. That's where they are. And you can rub them. I mean, you're rubbing through the trapezius, but there's no problem rubbing them. So, this is where anatomy comes in and applying anatomy. If I had a problem with a client and I was really sure that it was the semispinalis capitis, which is underneath the trapezius, but the trapezius is really tight, so tight that it's stopping me from rubbing through it into the semispinalis capitis, what could I do to get the trapezius out of my way? What could I do? Miss Wick?
Couldn't you tilt their head back, you're moving it so they're not contracting, so it'll be looser?
Yeah. So what she's saying is that's a really good answer. You could tilt their head back. If they tilt their head back, they're tightening up their traps. But if you tilt their head back, the traps are loose. Or if you elevate their shoulders for them, the traps are loose. I know when you elevate your shoulders, your traps aren't loose because your traps are helping you elevate your shoulders. But if I lift up the trap, they become loose in there. And that would mean they wouldn't be fighting me as I try to push through them. It's a trick we use when we're trying to get through layers of muscle. By the way, there's a lot of other answers that would have been acceptable. One thing is you try to loosen up the traps first, right? We work on those first. And that's really what happens by accident usually, is you start rubbing on the traps, they get kind of loose, and then you're sinking down through them really, and they're not out of your way, but they're soft, and then you're going into the semispinalis capitis. But it's really good to know that you can loosen stuff up. For example, I always use my arm because it's a simple one. What's the muscle that's on top here?
Biceps brachii.
Biceps brachii. Underneath it is the brachialis. Right now, it's kind of tight. I'm not flexing it, it's just tight because it's stretched out. If I bring it up here and let it flop, it's loose. Now when I squish into it, it's like going through jello, and I can get to the brachialis. So if I wanted to, the brachialis is not hard to get to anyway, but point is, if I wanted to, because I know anatomy, I can move the arm in a certain position to make the top layer of muscle soft so I can get to deeper layers. And I care for a couple of reasons. I obviously care for therapeutic reasons, right? But I also care because it makes me a better therapist than other therapists. And this is a competitive market. And better therapists get paid more. I'm sorry. I mean, not always, because sometimes they don't try to get paid more. But the fact is, better therapists get paid more. And you can get paid quite a bit as a really good massage therapist. If you're a mediocre one, and you just do a really good rub down, you don't really realize how to get to the deeper layers because you don't know your anatomy well enough to get down to deeper layers, you'll still make a decent living. But the really good therapist is able to get down to those deeper layers, and the client can feel it. And they're like, oh, nobody's ever gotten there before. Nobody's ever done that thing before. I feel better longer after I've had a massage from you. Well, yeah, I'm massaging more. And they therefore perceive you have more value, you're better trained, you're better. And they'll pay more for it. So that's kind of cool. That's why we're learning this. Just trying to bring it home for you. Mr. Kachekian, sir.
So as a rule of thumb to remember that when we're massaging any muscle, there's always a muscle underneath it too?
Yeah. I mean, obviously, that only works so long until you hit bone. But yes, there is usually muscles under almost all other muscles. Yeah. And that's a really good way to look at it.
Doing deep enough to get to those muscles instead of just doing the surface layer, which you just get the top layer.
And you could even, based on what you just said, that's not true everywhere. Some places are just bone below those muscles. But I like what he's saying. You could approach most areas of the body by kind of going over and rubbing them and saying, okay, now how do I get these muscles in a loosened position so I can go to the muscles underneath them? You really could do that. For example, the calf muscles. The calf muscles that are in our posterior leg region, right, that are in our sural region, those calf muscles have muscles underneath them. If I put the foot in a plantar flexion for the client, those calf muscles are loose. And then I can press through them and get to things like, that we haven't learned about yet, but like the posterior tibialis and flexor digitorum longus and flexor hallucis longus. And you all know the flexor hallucis longus goes to the big toe because I just told you hallucis always goes to the big toe. And there are like 8 muscles that go to the big toe, so it's kind of helpful to know, and they all have the word hallucis on. All right. Cool, so yes, Mr. Kachekian, well said. That's a really good way to think, is to start thinking kind of in 3 dimensions and realize there's probably something underneath that. The neck is a prime example, right? Underneath the trapezius on the neck, underneath the trapezius is the semispinalis capitis. Underneath that is, is the multifida rotatories. And really, also down there that we're going to learn about later is 2 other muscles too. But the point is, there's 3 layers of muscle. And it's one of the reasons we articulate the neck back when we have somebody laying face up, on their spine, is to let the trapezius get loose so we can start massaging the multifida and rotatories in there. Yeah. Yes. Cool. All right. So this is just overview. We're going to talk about these individual muscles right now, but it's time for a break. Yeah? Breaks are important. When we last left our intrepid explorers, we were talking about this big overview and talking about layers of muscle and all that good stuff, right? And we talked about how you remove the deltoids and the traps and you remove latissimus dorsi, and that gets you underneath to the erector spinae group, the spinalis, the longissimus, the iliocostalis, and then we tear that off, right? And we want to talk right now about the multifidi, rotatories, and semispinalis capitis. This thing they call the transversospinalis group that I have never heard mentioned that way outside of school. Let me share my slide here again. Let's talk about these muscles in more detail. Sorry. Okay. So, this is a good picture of the multifidi on one side, rotatories on the other. Remember, they're on both sides of your body. They're just trying to show stuff off here. And the semispinalis capitis. Can anybody tell me a difference they see between the multifidi and the rotatories? What makes them different? They both go, by the way, from transverse processes to spinous processes.
The size?
Yeah, that's right. Which one looks longer?
Multifidi.
And she's exactly right. So, and there's one other thing, by the way, Ms. Top, since you're on fire right now. What's the other thing you notice the multifidi covers that the rotatories doesn't cover? This is a perfect question for you.
Sacrum?
Yes. It is the covering of the sacred sacrum. And I love that. Anyway, the multifidi are longer and they cover the sacrum. And they still go from a spinous process to a transverse process, or a transverse process to a spinous process. But in general, multifidi like to jump 2 to 4 vertebrae when they go up. So they'll jump up 2 to 4. Rotatories only like to jump 1 to 2, 1 or 2 vertebrae. So honestly, if it was me naming the muscles, I would have called them just shoelaces, all of them. Because you can't feel the difference. To us, they just feel like a whole bunch of zigzaggy things really, really deep down there. It's even hard to feel that. But rotatories go from a transverse process to a spinous process of another vertebrae, but it's either 1 or 2 up. Multifidi go 2 to 4 up. So multifidi are just longer, and multifidi cover the sacrum. Yes. Yeah. Miss Sawick, please.
So they overlap. Which one covers which?
I have
which
no-
one's on?
I have no idea. I totally get what you're asking, but I have no idea at all.
Okay.
Oh, your book might say, and I know this is a lame teacher answer, but the reason I don't care. It's not that I don't care about your question. I don't care because from my point of view, there's just these crisscrossy muscles there, and I don't care if they're long or short. I want to hit them all. And so I'm not trying to but I suspect one is deeper than the other. If I had to
The
guess,
rotatories
rotatories
like
are
deep to the
deeper.
multifidi is
Cool.
what the book says.
yeah.
I guess I could regret that, but
No. You would think I would know. Anyway, so everybody, the rotatories lay deep to the multifidi, and but the fact is they're all shoelaces of the back. Yeah. And the semispinalis capitis attaches some of your transverse processes for part of your spine, semi-spine, part of the spine, and go to your head. Yep. Okay. So, here's again a picture of the multifidi and rotatories. Trying to think if there's anything to add to this. Because they go diagonal, they can help to rotate the spine. Yeah? Because it's kind of hard to explain, but If a transverse process over here grabs onto a spinous process, it can pull it this way. And they all kind of go up the back like that. So they can help unilaterally. If one side all pulls, they can help to rotate the spine. So they can help you when you twist and shout. Yeah? Bilaterally, if they're all pulling on the spinous process above them, they're going to pull you over backwards, which is called an extension of the spine. So they do help aid the erector spinae group. The erector spinae group is your powerhouse, but these guys help too. Yeah? And all you have to remember for origin and insertion on these guys, I don't care who the origin is and who the insertion is, but attachments for these guys is they go from a transverse process of one vertebrae to a spinous process of another one that's 1 to 4 vertebrae up. And the multifidi cover the sacrum. And I just learned today that the rotatories are deeper. And they all live in the lamina groove. That is important. They live. You're going to find them in the space between the spinous processes and the transverse processes, this lamina groove. That's why we dig down into the lamina groove. We try to get the spinalis out of the way and get into the multifidi and rotatories, because those little muscles get tired. And they do run fairly close over some tissue that's fairly close to your nerve plexes, the nerves that come out the side, and so they can cause back tension. Yay. That's the multifidi and rotatories.
Question.
Yeah.
So do they get pretty tight? Like, what's the problem? Is there like common problems with that muscle group?
Yeah. They get tight and they seem to kind of pinch on the nerve plexes that come out the side of your back. And so, well, a couple things. When they're tight, they can be holding your back out of alignment because they can actually help to hold vertebrae out of place. And by the way, your vertebrae don't completely come out of place, but they will move around a little bit. And so that can cause nerve pinching. They can do that. They can also just be general tightness back there, you're right, and kind of put pressure on nerves and stuff like that. So, real simply put, they're other back muscles that are commonly tight. They are. And it's pretty common. So if the back's tight, usually it's not just the erector spinae group, usually it's the multifidi and rotatories too. So it's an important layer to consider just from general massage tightness, absolutely. But can they pull on individual vertebrae and keep them out of alignment a little bit and things like that? Yes, they can. Does somebody adjust easier at the chiropractic office if you loosen these up? Yes. Yeah. Yeah. Good question, by the way. Thank you. And then we have the semispinalis capitis here, which attaches the transverse processes of C4 through T5 up to the back of your head to something called the nuchal lines. And it's important you understand the concept of the nuchal lines. Whether they're superior or inferior is pretty nitpicky, but the back of your head has a bump. Do we remember this? Everybody can feel the bump on the back of their head. Some people's bumps are really big, some people's are not. It doesn't matter, but you should be able to feel a little bump back there. It's a tiny little bump, fairly low on the skull. That is your external occipital protuberance. External occipital protuberance. Out of the sides of that you may or may not be able to feel, depending on how much fascia is on the back of your head, is two ridges, right? And the one you can probably feel is called the superior nuchal line. It's just the ridge on the back of your head that comes off this bump. And you may or may not be able to feel it, but there's a ridge there coming off that bump that goes out to the sides. And that's called the superior nuchal line. Deeper in is the inferior nuchal line. You basically can't feel it. But a lot of muscles like to attach up there. Your trapezius like to attach to the superior nuchal line. This guy likes to attach between the superior and inferior, and later we're going to learn muscles that actually attach to the inferior. I don't care, and nor do you really, which nuchal line it attaches to because they're right next to each other. The point is, these guys attach to those nuchal lines back there. The edge of the of the skull outside this external occipital protuberance. That is important. Because we're going to find that this area back here where the nuchal lines are is super duper important. There's just so much junk attaching to them. We've already got the longissimus going all the way up to the lateral edges of the nuchal lines and the thing that is hooked to the temporal bone. Why am I not remembering this? The mastoid process. Yeah, I did go to school. Mastoid process of my temporal bone. And so my longissimus already goes up to these nuchal lines and stretches across the mastoid process. But anyway, these nuchal lines. Longissimus does, trapezius does, now we're learning the semispinalis capitis does. So we're going to learn lots of stuff, and later we're going to learn about suboccipitals that are underneath all this stuff that kind of tie your head to your first couple of vertebrae. And so there's a lot of junk going on back here at the back of the scalp. And I honestly, this little area about 2 fingers wide here is super duper important. I massage it on everybody. I mean, I'm not saying there aren't massages where I don't. Like somebody comes in and says, just work my feet for 2 hours. I don't go rub the back of their head. But if you don't say anything, that's an area I hit on everybody. Like there are a couple of areas I hit on everybody if you don't say anything. If you come in for a full body, I am definitely going to do your occipital region right around your nuchal lines. Always, 100% of the time. I'm always going to do your feet if you don't say anything. I'm always going to work around your sacrum if you don't say anything. Always. Always. I'm always going to work your spine, of course, and your shoulders. But everybody works your spine and your shoulders. But I honestly say, like this area, the back of the head, where these nuchal lines are, the spine, shoulders, sacrum, and hips and feet. I can't imagine doing a massage without doing those. Super important. And I used to have a client who suffered from many clients suffered from migraines, but I used to have a client who suffered from migraines that would come in for hour massages, and all she wanted me to do was work the back of her head and neck for the entire hour. I loved it, by the way, because we sat down and we just kind of worked on all that stuff. You get really good at things that way. But, I mean, and we worked that area. And she said it was the only thing that gave her relief, you know. I was always trying to get her to let me do a little bit more because I'm like, you got back problems too. But anyway, that's what she wanted. So, super duper important area. Don't forget it. On some people, it's very sensitive. Actually, almost everybody it's sensitive, but some people like it and some people don't. But super important area. Okay, semispinalis capitis. Transverse processes of the vertebrae from T3 to C4, which is about, where is it? Right about here. Hooks onto these guys and goes up and hooks in the head. Just helps kind of tie your head to your torso. And these are the speed bumps of the neck. Because even though they're underneath the trapezius, they're actually what makes those 2 little columns on the back of people's necks. Now when you're walking around and you're looking at the back of people's necks, you can be like, semispinalis capitis. Yeah. Whisper it in their ear behind them. No, don't do that. Okay. All right. So, these guys live in the lamina groove. This is a great picture of all of them, right? We see the multifidi on top because apparently they are superior to the rotatories. And you can see them on top here, and this is why somebody gets their fingers in right next to the spinous processes, right? So they can massage them. They are most easily felt in the thoracic and lumbar regions because you got a lot of neck muscles that get in their way when you're in the neck region. But you can feel them. Super duper important to work on. I love getting in there, and I really try to dig in on them. First, I'll like elbow the back and try to loosen up the spinal erectors, and then I'll try to get into the multifidi and rotatories. People love it. You can work on these, by the way, when somebody is face up, believe it or not. You can actually reach under their back and use the weight of their body to come down on your hand and work them that way too. And I say that because sometimes you get people, Ms. Smith, I don't know if you've ever felt this way, but since you mentioned the back thing, sometimes people with bad back problems, we can't even get them on their stomach. And we get them on the table just laying on their back, and I sit there with my fingers underneath them and just slowly for the whole hour just sit there and just work their spine, kind of right next to the spine, working the multifidi and rotatories nice and slow with their body weight on my hands. Everything's really gentle, And then we slowly get them up from the table afterwards. That's all we can do. Really slowly get them up from the table, by the way. That's usually when they spasm. Okay. So it's the longissimus and spinalis that tend to be in your way. And you move them aside, believe it or not, you can kind of pull them back, right? You can kind of pull them back and kind of get into the spine. That's why you see this kind of hand action here. And then you can work the shoelaces of the back, multifid and rotatories. Yay. Kind of cool. So many fun things to do, the back. All right. So, we learned about the semispinalis capitis, which goes from part of my spine to my head. It is the speed bumps of my back. Yeah? We also have two other neck muscles that we need to learn about now. And that is the splenius capitis and the splenius cervicis. Splenius means spine, so the splenius capitis probably goes from what to what? Just in general, from what to what?
Spine to the head.
Thank you. Splenius capitis goes from your spine to your head. What do you suppose splenius cervicis does? Go for it, Miss Tops. Nobody else is going to answer. She's like waiting very politely. No, you don't know? I didn't mean it like you don't know, but I just meant, I thought you were getting ready to talk. Anybody?
Spine to your cervical.
Yes, cervical. Thank you. Miss Mitchell said too. That's why I was turning my side. But yes, Miss Smith, you're absolutely right. Spine to cervical. Cervical, cervicis. So these muscles are deep to the trapezius. They're way the heck back there. The splenius capitis goes from the spinous processes of T7 to, C7 to T4, and goes up and attaches to the lateral portion of the superior nuchal line again, and the mastoid process. We now know the mastoid process, by the way, you can all feel here, it's behind your ears, and it's the bumpy bone here that's sensitive behind your ears. It is part of your temporal bone. It's part of your ears in a way. We now know three muscles that attach to the mastoid process. Anybody want to tell me one of them?
Longissimus.
Longissimus. The longissimus goes all the way to the mastoid process, and I realize the superior nuchal line too, but it goes to the mastoid process. Yes, sir. Thank you. Longissimus.
The sternocleidomastoid.
Yes, the sternocleidomastoid in front. Hey, the longissimus can extend my neck, and the sternocleidomastoid can flex my neck. Could they argue? Could they be antagonists? No, that's not important. You guys ignore that. Okay, so, no way. So, and we've learned this muscle, the splenius capitis. That's kind of weird, by the way. I just realized we've got, let me undo this here for a second, because I kind of want you to be able to see me. I just realized we've got this longissimus coming here and back. We've got this sternocleidomastoid in front, kind of create triangles this way, and then we've got this splenius capitis that's an upside down triangle going this way. So you got this kind of this muscle that kind of hooks the mastoid process and kind of pulls my head left and right. And I got these ones that pull it front and back for the mastoid process. They kind of all triangulate. They really are triangles, by the way. One's an upside down triangle going up here. The longissimus and the sternocleidomastoid are triangles going this way. You're going to see lots of triangles in the body. The body triangulates a lot. It triangulates a lot because it's a really great way to suspend stuff and move stuff. But it's almost like these mastoid processes are kind of control areas for moving a head around. I mean, just those three muscles alone can cause me to flex, extend, laterally flex, and we even probably can get some rotation out of them if we need to. Definitely can get some rotation out of them. So those three muscles, and they're all vying for attention in that one area. Nah, it's probably not important. Yes, Mr. Kachekian.
So So would all those muscles be antagonists of each other?
Yes. They could all be antagonists of each other. I mean, not yes. The short answer is yes. That's the point I'm trying to make, actually. The sternocleidomastoid could be an antagonist to longissimus. Longissimus could be an antagonist to the sternocleidomastoid. The splenius capitis could be an antagonist of itself from left to right. It can operate separately. So it can be an antagonist of itself from left to right. And they're all grabbing on to this mastoid process of the temporal bone. Mastoid process is a bump on the temporal bone, which is right here in my head. And let's just talk about the temporal bone for a second. The temporal bone, I wish it was colored here. This is not the color of the temporal bone. That's where a muscle attaches. The temporal bone, though, is basically this big feature right here. This whole area. Temporal bone. I didn't realize this is a jaw down here. This whole area right here. The temporal bone has some really interesting features to it. Some landmarks that are really important. One is this little blue thing here. Really hard to see, but that is your mastoid process. That is where the longissimus is coming off down here. The sternocleidomastoid is coming here. Splenius capitis is coming down here. All off this mastoid process. It's also got a hole here called the external auditory meatus, which is your ear hole. That's it. It's also got a little toothpicky thing you can't even see here in here called the styloid process. You don't have to worry about that yet, but the point is it's another attachment for muscles that are deep inside your neck. Really deep. Really tiny muscles. It's also got this place that articulates with the jaw. Anybody know what your jaw joint's called? The official name for your jaw joint?
Isn't it the temporomandibular joint?
Yes, it is where the... It's exactly what it is. Temporal mandibular joint. It's where the temporal bone attaches to the mastoid process. I'm sorry, attaches to the mandible. I apologize. Temporal mandibular joint. Your jaw joint is made with your temporal bone in your jaw. The same bone that has the mastoid process and all those muscles tied to it, the same bone that has your ear hole in it. I wonder if you had tension and all that stuff on the mastoid process of your temporal bone, if that could give you if that could affect temporal mandibular joint syndrome, or if you could get ringing in your ears even, tension. Nah, probably not. Never mind, guys. Okay. Don't worry about that. It's not really an important place in the body at all. It is super important. This is super duper important. Don't ever forget about the mastoid process of the temporal bone. It affects temporal mandibular joint syndrome. People can get ringing in their ears. It can create headaches. It does all sorts of stuff. It's amazing. The temporal bone is also hooked to all the other bones in your skull. It can lead to all sorts of things, which means tension in my butt, essentially, of that longissimus could be affecting my jaw. That is not a crazy, far-fetched thing at all. Yeah. Thank you. Whew. Don't ever forget about the mastoid process and the three muscles that attach to it. There will be a fourth muscle coming too. Okay. Let's go and look at this again. So, I went on a tirade there and a big tangent because we were talking about the splenius capitis. And the splenius capitis attaches to the superior nuchal line and the mastoid process. And then Tapscott had to talk about all the muscles that attach to the mastoid process. And that was the longissimus, the sternocleidomastoid, and the splenius capitis. And then I had to make a big deal about how important that was, because that could be an area of high tension and an area you should be rubbing on everybody. As you rub the back of the skull, get all the way over to the mastoid process, because it can affect temporal mandibular joint syndrome, it can affect general tension, it can affect headaches, it can affect ear problems even. tension in that area. Okay. The other muscle, as we come back to reality here, the other muscle I want to talk to you about is the splenius cervicis. Yeah? And the splenius cervicis is essentially does exactly that. It attaches from your spine to your cervical vertebrae, to the transverse processes of your cervical vertebrae. So it attaches the spinous processes. Sorry, let me get this up here. Spinous processes of your spine here to your transverse processes of your neck. C1, C2, C3. Do we know of another muscle that inserts into the spinous processes of C1, C2, C3, and in this other muscle's case, C4?
Elevator scapula?
Yes, the levator scapula. Levator scapula inserts from the shoulders, right? From the medial border close to the superior angle of the scapula into the side of the neck, into the transverse processes of C1, C2, C3, C4. This muscle, this splenius cervicis, goes from your back up into those vertebrae as well. And I point this out because you've got an awful lot of important neck nerves that come out. And where do the neck nerves go to? By the way, most of your neck nerves go to where?
Brachial plexus?
Yes, they go to feed your arm. So when you get clients that come in and they're having problems in their arm, they might have problems in their arm, but they could have pinched nerves in their neck. And it could be muscles like the levator scapula, the splenius cervicis. Those muscles could be part of the problem. The semispinalis capitis too, because it likes to grab onto transverse processes and such. So it could be those muscles as well. That's why this stuff is important. That's why we wiggle necks around and move them and all that kind of stuff. I hope that we can see that both these muscles could help to rotate the neck, depending on how they pull when they work unilaterally. They could laterally flex if one side's working, because they're on the side, they can help pull your head over. And they can help to, both sides pull, they can help to extend your neck. And I hope we're starting to see that there really isn't just one muscle that does one thing in your body, right? Usually muscles work in groups. They work with varying degrees of power, depending on how much power you need, and also just the exact specified thing you need. Like your body understands the difference between rotating your head and tilting it down a little bit, swishing it back. All those take very small, minute differences in your muscles, and your brain takes care of all that for you, which is pretty nice. It didn't when you were a baby. You had to learn it. You just don't remember. Yeah. Okay. So far, let's back up a little bit. Yeah? So far, we've really learned about the shoelaces of the back, which is the multifidi and rotatories. Right? They live in the lamina groove. They can help you twist. They can help you extend. Live in the lamina groove. Live in the lamina groove. Shoelaces in the back, multifidi and rotatories. And then, I know that your book didn't divide it up this way, but in a way we learned about 3 neck muscles then. We learned about the semispinalis capitis, the speed bumps to your back, and we've learned about the splenius capitis and splenius cervicis. To me, those are all neck muscles. Yeah? Because they kind of tie my back to my neck. That's how I would have divided it up. But nobody asked me when they wrote this book. Cool. So
I have a quick question about the multifidi and the rotatories.
sure.
So you might, I guess this might be a better question to cover the nerves, but how, I don't know, how do they work? Are they like individually going off as you rotate?
Yes. So
All at a tiny one?
yeah, so it's a really good question, Ms. Zwick. And the answer that I'm about to give you applies to every muscle in the body as far as I know. I'm sorry, Ms. Smith. It applies to every muscle in the body that I know. The answer is yes, they can do that, and no. And I'm not trying to play in the middle. What my point is this. Your brain has the ability to fire off a single multifidi or rotatories if it wants to. But it even has more than that. it has the ability to fire off a single strand of a single multifidi or rotatories. So when we talk, let's go back to the biceps because it's easier to think about, but let's look at the biceps brachii, this big muscle on top here. My brain can fire off a single strand of that or a group of 100 strands of it or whatever it needs. Sometimes it doesn't have control down to a single strand. Some areas it does. But the point is it can fire off little bits of that. And the multifidi and rotatories are exactly the same. Your brain could, if it needed to, and if you had practiced the movement, if you had a reason for doing it, could fire off the multifidi from T12 to T8 and nothing else. On the left side, it could fire off probably half that multifidi from T12 to T8 if it didn't need all that strength, right? Remember, it's an all or nothing principle. It usually is obviously firing off multiple muscles to get you to twist, and it's trying to kind of affect multiple ones to get this movement to occur. But yes, it has the ability to do that. And yes, even when it's firing off multiple ones, they are all separate signals being coordinated by your brain. Of thousands and thousands and thousands of nerves just for me to do this. My brain, and that's why we have subconscious subroutines in our head. My brain had to send down these signals and say, I want you to fire off, these 36 rotatories and multifidis on this side only, and with about this amount from each one. Right? Because it doesn't want to, if it fires them off all really hard, I do that. But if I want to control that, my brain literally said, I still want to fire off the same ones, but only about 20 nerves, 20 fibers from each one. It really is making these very complex decisions. And all I have to think is turn left. But that is what babies are doing, believe it or not, when they seem like they're doing nothing, is their brain is wiring and they're starting to figure out how to move their body. And that is what you guys do when you learn to massage. By the way, you're learning a new technique with your hands and your brain is starting to go, oh, and after a while you can just tell your hands to do that and it's automatic. Yeah, thank you. Thank you, Ms. Smith. Really, really good question. Okay. So, boom. So, what are the two shoelaces of the back, Miss Magruder?
Are multifidi and row. I need help with this.
No, that's okay. Multifidi is fine, or multifidi is fine. Both those are correct. And rotatores.
Rotatores.
Yeah, rotatores. Yeah.
Rotatores.
Rotatores. Yeah. Cool. That's perfect. Thank you. Thank you, thank you, thank you. What are the shoelaces of the back, Miss Lopez Moreno?
The rotaries, I think, and then the multifidi.
Yeah, rotatores and multifidi. Yeah, multifidi is probably right too. Who knows? Anyway, good job. Thank you, thank you. What are the shoelaces of the back, Mr. Kachekian?
The multifidi and the rotatories.
Yes, I'm going to add, that's 100% perfect, sir. I'm going to add a bonus question on top of that. Which one, it's only one of those two, also covers the sacrum?
Multifidi.
Yes! Multifidi also covers the sacrum.
Multifidi.
Yeah. Also covers the sacrum. Awesome. What are the shoelaces of the back, Miss Tops? Sorry, I know you're eating, but...
Multifidi and rotatories.
Yes, and which one covers the sacrum?
The multifidi.
And which one's longer?
The multifidi.
Yeah, it's kind of easy to remember that, everybody, by the way, because it's longer, which is how it gets down to the sacrum in the first place. Awesome. Well done. Thank you, thank you, thank you. Okay, and then we've got these three neck muscles we learned today so far, which is the speed bumps to the back, the semispinalis capitis. I just looked at Ms. Mitchell. She's like feeding me answers over here. Semispinalis capitis, splenius capitis, and splenius cervicis. So 3 neck muscles that we just learned today, and they're all kind of in the same area-ish, and they all kind of go up to the nuchal lines, right? That's not quite true for the splenius, splenius cervicis, but they're all up in that little area back there in our neck to kind of point out how important it is back there. So, what are the names of the three neck muscles we have just learned today? Ms. Caviso.
The splenius capitis, the splenius cervicis, or cervicis, and the semispinalis capitis.
Beautiful. Thank you, ma'am. Couldn't have said it better myself. I love that. What are the three neck muscles we just learned, Miss Kilpatrick?
All I knew was gonna call me.
Good.
And then you gave me the hardest word, the semi-calapitus,
Semispinalis
semi-spinalis,
capitis.
capitis, semi-calap.
No,
Hold
you,
on. Sorry.
no, you said it right. It's semispinalis capitis.
Okay. Semi-spinalis capitis.
Boom. Great. And then there's splenius capitis.
Splenius capitis.
Yeah. And then there's splenius cervicis.
Splenius cervicis.
Good job. Thank you. Really appreciate it. Takes guts, man, to say like words you haven't said before in public and all that kind of stuff. That was awesome. Thank you. Miss Junta Bone. What are the three neck muscles we just learned?
Semispinalis capitis
Oh my god, that was perfect. Yes.
and spine. I don't know how to spell.
Splenius.
Splenius capitis
Yes.
and splenius cervicis.
Yeah, that was perfect. Cervicis. That was beautiful. Thank you. Thank you. Awesome, awesome, awesome. Okay. Moving right along. Let's see. Hold on, everybody. Okay. I'm going to tell you about some other muscles here that you probably won't hear about after class anymore. We don't usually talk about them much, not because they're not important, I guess, but they're very tiny and they are super deep. This is like level 5, right? We just went through level 4. These guys are really, really deep. And they actually run between the transverse processes and the spinous processes of the vertebrae. And you only find them in the neck and the lumbar region. Why do you suppose you don't find them in the thoracic region, by the way? Any guesses? You can't be wrong, by the way, nobody knows. So this is a great time to make up a really creative answer. Mr. McClure.
My guess would be that the ribs are there.
That's an excellent guess. And you could be 100% right. Do we have any other guesses? By the way, I mean, honestly, his guess is as good as the answer I'm about to give you. Mr. Kachekian.
Because there's a sternum in place of the spine.
Can you elaborate on that?
Oh, never mind.
No. That's actually kind of what I'm going to say, but I just don't feel like you explained it. No?
I'm trying to...
I'm trying to put it into words.
It made sense in my head for a second.
Would you like me to add to your answer?
Yes, please. I apologize.
No, don't apologize. He's right, by the way. I think, by the way. And Mr. McClure, I don't know. I'm not just trying to be nice. I don't know. But if you think about it, the neck is completely unsupported here, right? And the lumbar area is completely unsupported. But what does the thoracic vertebrae have? They have the ribs coming around to the sternum. It's almost like you have a spine in front of your other spine. I know the sternum doesn't bend, but it provides support in that area. So you've got all these ribs helping support how much you bend in the thoracic area. It gives you a lot to work with in the thoracic area, whereas the head and neck need extra stabilizing power. But it could just be because the ribs are in the way too. Who knows? I don't know. These are questions that I'm going to ask God when I die. I've got a list of questions. Believe me, and this is one of them. I'm like, why not just run up the whole back? Did you get lazy? What happened? You didn't fill in the middle? Probably won't put it that way. I'll be a little more respectful. Okay, so the point is in the lumbar region, between the transverse processes, we see these things called intertransversari. They're they're between transverse processes, they're multiples. Intertransverse, and we see them also between the little neck stuff, and they're super deep, which is why I was like, you definitely are going to push on tissue that might push on them, but I don't know if you ever can actually feel them. You can try. Let me know. Be nice when you try. And you've also got interspinalis muscles. Same thing, between the spinous processes. The reason these are very hard to feel, you'd think you could just press between the spinous processes and feel them. Like you could just press in here and do that. But the problem is you've also got a ligament that runs over all your spinous processes. So we've been talking about muscles. If we had a class on ligaments, you guys would have to be here for 3 years. Because there are way more ligaments than there are muscles. And so part of the thing that ties your whole body together, we've been focused on muscles, but there's ligaments everywhere. And you've got ligaments running all the way down your spinous processes to help hold your back together. And you'd have to get through all those ligaments to fill the inner spinalis muscles. But again, they're just in the lumbar and cervical region. So honestly, I mean, you will have some test questions on this today, but not at the end of the year. I'm not going to come back and be like, remember these obscure little muscles. But you should know that underneath the rotatories and multifidi are some really, really, really deep and neck and lumbar muscles that help also tie the vertebrae together, probably to give them more support in those areas. And they're called the between spinous process muscles or the between transverse process muscles. But they say that really fancy and in Latin, and they call it the intertransverse in the interspinalis muscles. Yeah. I'm not trying to minimize them. It's just that they're very hard to get to. Probably get to them more with stretching and things like that in those areas. Yeah? All right. Let's take another break here, because that's the end of at least our slide presentation kind of stuff. We'll come back and we'll circle the wagons and take it from there. All right? 10 more minutes. We'll be back at 10:02. Yeah. Thanks, everybody. All right, everybody. We're back. I'm going to release homework soon. Do we have any questions? I thought I'd do a real quick review and then see if you have any questions and then release homework. Questions about the shoelaces of the back and the 3 neck muscles we just learned? Yeah? No? Maybe not? Good. All right. Mr. Bigelow.
Yes.
What are the 2 muscles that I keep referring to as the shoelaces of the back?
Rotatories and multifidi.
Yep. Which one's longer?
Multifidi.
Yep. Which one covers the sacrum?
Multifidi.
Yep. And I haven't asked this question yet, but if you think about it, I think you'll be able to answer it. They essentially attach what to what? They always run from one thing to another thing. They always run from one vertebrae to another, but what place on those vertebrae do they run from and to? Do you know what I mean?
Transverse processes and the spinous processes?
Yes! They go from the little guys out here, if I was a vertebrae, to the nose of the next guy. They go from the transverse processes up to a spinous process of another vertebrae. Thank you. He really just summed up the whole thing beautifully for us. Ms. Cafisto, you raised your hand, but then didn't. Are we good?
Yeah, I was just going to answer the question, but you beat me to it.
Oh, okay. Well, that's all right, Ms. Cafiso, because I would love to hear what the shoelaces of the back are called from you.
I was going to talk about what they do, but the shoelaces of the back are the rotatories and the multifidi.
Okay. Which one's longer?
The multifidi is longer. The multifidi or the multifidi?
Multifidi. Yeah.
Multifidi.
I like multifidi. Kind of sounds like a rapper's name. Yeah.
It does sound like a rapper.
Yeah. And which one covers the sacrum?
The multifidi.
Yep. And they go from where to where? What are their 2 attachments?
The transverse processes to the spinous processes.
Yes. And if they work bilaterally, to get what you were going to talk about, which I love, if they work bilaterally, both sides working, what do they do to the vertebral column?
They flex it laterally?
If both sides work, if both sides are pulling bilaterally, what do?
They help you stand up straight? I don't know.
What am I doing?
Oh, they help you extend?
Yeah, they extend the vertebral column. They bend you
Okay,
backwards, just like
Thanks
this.
for that.
Now, if they work unilaterally, what do they help you do?
Rotate?
They help you rotate. Yeah,
Okay.
that's awesome. They probably
Thank you.
do. I know the book doesn't say they probably do help with side flexion a little bit because of the way they run. But anyway, yes, they help you extend and rotate. That's awesome. Thank you, thank you, thank you. Mr. Ashaka Lee, you know I'm going to ask this. What are the shoelaces in the back, sir?
The rotatories and the multi-fitting.
Thank you, sir. Which one covers the sacrum?
The multi-fitting.
Thank you. Which one's longer?
The multi-fitting.
Yep. They attach what to what?
Transverse to spinous processes.
Yes. If they work bilaterally both sides, what do they do to my vertebral column?
Extend it.
Thank you. If they work unilaterally, what do they do to my vertebral column?
Rotate.
Yes. And they are found in what groove? It's the name for the groove between the spinous process and the transverse process. We call it the something groove.
The lamina.
Bam. Thank you, sir. Bam. And that really does sum up everything I can think of to ask about those. Really well done. Thank you. Okay. And then we learned about 3 neck muscles, right? Yeah. Sure we did. Miss Stewart, what were those 3 neck muscles?
The semispinalis capitis, the splenus capitis, and splenus cervicis.
Yeah, that was beautiful. Thank you. I love it. Awesome. What were those 3 neck muscles, Miss Langford? Miss Langford? What were the 3 neck muscles?
The splenius cervicis, the splenius capitis, and the semispinalis capitis.
Yeah, I love it. Thank you. Beautifully put. What were those 3 neck muscles, Miss Flores?
The semispinalis capitis, the splenius capitis, and the splenius cervicis.
Yeah. That was perfect. Cervicis. Beautiful.
There
Thank you, thank you, thank you. What were those 3 neck muscles, Miss Vega?
The semispinalis capitis, the splenus capitis, and the splenus cervicis.
Yeah. Which one of those is also known as the speed bumps of the neck?
The semispinalis capitis.
Yes, thank you very much. Awesome. Speed bumps of the neck. Cool. Mr. Penrod, what are the 3 neck muscles we learned about today?
Semispinalis capitis, the splenius capitis, and splenius cervicis.
Yeah. Which one of those is known as the speed bumps of the neck?
Semispinalis capitis.
Yes. I feel your pain, by the way. Semispinalis capitis. That's awesome. Which one of those inserts into the mastoid process that I made such a big deal about today?
Was that the splenius capitis?
Yes, it goes from the spine out to the head in an upside-down triangle. Splenius capitis. Thank you very much, sir. And which one of those inserts into the same place that the levator scapula inserts, essentially?
Was that the splenius cervicis?
Yes. Hooks into the side of the neck just like the levator scapula. Thank you very much, sir. I'm trying to connect, by the way, anatomy together in ways that are useful to us, right? So it's just not this dry thing. It's really good. I love it. So what are the 3 neck muscles, Miss Ramirez?
I knew you were going to call me.
Yeah, it had to happen.
Yes.
We-
Spinalis capitis.
Yes.
Spinalis cervicis.
Cervicis, yes.
Cervicis and spinalis. I don't know how to say the last one.
Semispinalis.
Semispinalis.
Capitis.
Capitis.
Yeah, that's perfect. That's great. That was wonderful. That was so wonderful. I think we should say it one more time. Please.
Spinalis capitis and spinalis cervicis.
Yes.
Spinalis
Semispinalis.
semispinalis.
Capitis.
Capitis.
Really good job. Thank you. Thank you for doing it twice. I appreciate it. Cool. And Miss Mitchell. Sorry, she's over here. I'm not just making it up. Which one of those three neck muscles is the speed bumps of the neck?
The semispinalis capitis.
Yes, the semispinalis capitis are underneath the traps, but they actually poke them up a little bit. Speed bumps to the neck. Which one of those inserts into the mastoid process?
The splenius capitis.
Splenius capitis goes from the spine to the cap. That makes sense. And which one of those inserts into the side of the neck where the levator scapula hooks in?
Is it also the splenius capitis?
Is splenius something neck? Splenius cervicis. Cervical cervicis. Awesome. Thank you. Nicely done. Okay. And the last point I want to make was I made a really big deal that three muscles attach to the mastoid process. Three muscles attach to the mastoid process and can pull it all over the place. It can cause headaches and jaw problems and all sorts of stuff. And I said, hey, it's really, really important. And so it's really important we remember what those three muscles are that attach to the mastoid process. Yeah? Miss Zwick, what are the three muscles that attach to the mastoid process?
There is the sternocleidomastoid, longissimus, and the splenius capitis.
Beautiful. Thank you very much. Thank you, thank you, thank you. Miss Smith, what are the three muscles that attach to the mastoid process?
The sternocleidomastoid, longissimus, and splenius capitis.
Thank you, thank you, thank you. Mr. McClure, what are the three muscles that attach to the mastoid process, the temporal bone?
The longissimus, the sternocleidomastoid, and the splenius capitis.
Yes. Which one of those muscles is also nicknamed the prayer muscle? Because it bows your head down in prayer.
The sternocleidomastoid?
Yes. If that guy contracted in front, it would bow your head down. Bilaterally, by the way. It can also be rotating all sorts of stuff. But that's awesome. Thank you, thank you, thank you. Cool, cool, cool. I think that's good. Should we release homework, everybody? Yeah, it's a good time. All right, let me get your homework up here. You'll have time to hopefully do it in class here. That's the idea, at least. Bear with me.